Protein concentration of CSF is increased in conditions except option A bacterial infection, option B viral infection, option C fungal infection, option D TB meningitis, and the answer is option C fungal infection. Dash is the best preservative of stool for routine work. Option A formalin, option B polyvinyl alcohol, option C thymol, option D none of the above, and the answer is option A formalin. In meningitis, CSF chloride level, option A increased, option B highly increased, option C decreased, option D normal, and the answer is option C decreased. Wet mount examination of CSF is mainly done for the diagnosis of option A meningitis, option B tuberculosis, option C leishmaniasis, option D trypanosomiasis, and the answer is option D trypanosomiasis. The indicator used in Shales and Shales method of CSF chloride estimation is option A bromophenol blue, option B phenol red, option C phenolphthalein, option D diphenyl carbazone, and the answer is option D diphenyl carbazone. In traumatic tap blood stain, option A uniform in all the tubes, option B varies in different tubes, option C no blood stain, and option D gradually decreases, and the answer is option B varies in different tubes. Following are quantitative method of CSF glucose estimation except option A fall-in-view method, option B orthotoluidine method, option C Nelson-Somogyi method, option D Benedict method, and the answer is option D Benedict method. The test used as a screening test for CSF protein is option A sulfosalicylic acid method, option B Pandy's test, option C heat and acetic acid test, option D contact test, and the answer is option B Pandy's test. Serological examination of CSF is done mainly for the diagnosis of option A typhoid, option B cholera, option C syphilis, option D meningitis, and the answer is option C syphilis. Normal glucose concentration of pleural fluid is option A 30 to 60 mg per dl, option B 60 to 90 mg per dl, option C 70 to 110 mg per dl, option D 20 to 40 mg per dl, and the answer is option A 30 to 60 mg per dl. Major source of fructose content in semen is option A seminal vesicles, option B prostate gland, option C testis, option D Cowper's gland, and the answer is option A seminal vesicles. Major percentage of semen ejaculates comes from option A testis, option B prostate gland, option C seminal vesicles, option D urethral gland, and the answer is option C seminal vesicles. Absence of or reduction in sperm movement is called option A aspermia, option B azoospermia, option C asthenozoospermia, option D oligoasthenozoospermia, and the answer is option C asthenozoospermia. For examining semen morphology, mucus can be removed by option A sulfuric acid, option B sodium citrate, option C hydrochloric acid, option D phenol bicarbonate, and the answer is option D phenol bicarbonate. Normal pH of semen is option A 6.5 to 6.8, option B 7.9 to 8.1, option C 7.2 to 7.8, option D 8.4 to 8.6, and the answer is option C 7.2 to 7.8. Absence of spermatozoa in semen is called option A aspermia, option B azoospermia, option C hypospermia, option D asthenozoospermia, and the answer is option B azoospermia. Semen diluting fluid contain all except Option A, sodium bicarbonate. Option B, sodium citrate. Option C, phenol. Option D, distilled water. And the answer is option B, sodium citrate. Normal semen fructose concentration is option A, 60 to 100 mg per dl. Option B, 100 to 200 mg per dl. Option C, 150 to 300 mg per dl. Option D, 200 to 400 mg per dl. And the answer is option C, 150 to 300 mg per dl. All are counting chambers used in semen counting except option A, improved Newbar counting chamber. Option B, Fuchs-Rosenthal counting chamber. Option C, marker counting chamber. Option D, Horwell fertility counting chamber. And the answer is option B, Fuchs-Rosenthal counting chamber. All are organisms associated with the polyspermia except option A, E. coli. Option B, Shigella species. Option C, Mycoplasma trachomatis. Option D, Candida albicans. And the answer is option B, Shigella species.